America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone. Hi, everybody, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Alfredo Ortiz, CEO of Job Creators Network.
Small businesses are being crushed by skyrocketing healthcare premiums, but Congress now has an opportunity to pursue reforms that will lower costs and expand choice. Today, we are joined by former Secretary of Health and Human Services, Dr. Tom Price, to break down what some of those ideas could be. Welcome to the show, Dr. Price.
Hey, Elaine, thanks so much. Wonderful to be back with you and with Alfredo and JCN and just support so much the incredible work that y'all are doing. So thanks so much for the opportunity to be with you.
Well, we've had a long partnership on healthcare, which we appreciate so much from you and the work that we've done together. But you've been in this fight for a very long time when you were on the Hill in Congress. And we've just come out of a 43-day shutdown. The Democrats shut down the government because of the fight over the enhanced Obamacare subsidies. And as part of that agreement to reopen the government, that vote on the subsidies is taking place tomorrow,
That's right.
Thursday. And so some of the Republicans have put forth an idea as well. So there'll be two bills voted on. It's my understanding that neither of the bills will probably pass. But what are your thoughts on what the Republicans have put forward for a counter bill?
Well, every one of the gray hairs on my head has come from fighting this battle for health reform for the past decades. The challenge that we have is that most often in Washington, nobody truly addresses the root cause problems that exist, the root causes that have created this difficulty in so many people having health coverage and health insurance that's just basically unaffordable for them, or it doesn't do for them what they want. So from a Democrat standpoint, what they want to do is just continue to throw money at the problem and allow individuals to buy into or to get some kind of coverage that likely doesn't solve the challenges that they have. From a Republican standpoint, it's usually that light. And so I think you're right. I doubt that either of them will get the votes needed to pass. And I don't think that the Republican plan in the Senate could actually pass the Republicans in the House. But what we need to do is to look at truly the causes of why we find ourselves in the challenging situation that we do from a health standpoint and address those causes. And there are relatively easy ways to do it, as both you and Alfredo know.
Yeah, so I had an op-ed earlier this week in the Orange County Register talking about some of the ideas and that Congress could use to reform Obamacare. One of those ideas is association health plans. And we've worked together on this issue before. Talk to us about what association health plans are and the efforts to get them passed. I know you've worked on this in some bills in Congress when you were there, and we've worked together on it. Talk to us about what association plans are and what they could do for our healthcare system.
Yeah, it really is an important point and question, because the folks that are challenged most in our system right now, everybody has challenges, but the folks that are challenged most are those that aren't getting their coverage through their employer. The employer-sponsored insurance is the way that vast majority of Americans gain health coverage. It's about 160, 170 million individuals who get their health coverage through their employer. Now, when you go way back and see, well, why is it? Why is health insurance hooked to the employer? It goes all the way back to World War II and the fact that the federal government had to decide at that time whether to treat employers providing health coverage for their employees as a taxable event or a non-taxable event. And they chose to treat it as a non-taxable event, which means that employers have a tax incentive to provide health coverage for their employees. However, that only works if mostly for the largest employers. If you're a small employer, if you run a small business, if you've got just you and your spouse, or you and some friends, or up to 10, 20, 30 individuals in your company, the likelihood is that you can't afford health coverage for your employees. So those individuals are thrown into what is called the individual market, trying to find health coverage for themselves and for their family that they can actually afford. Because it's not pooled resources that are purchasing that coverage, the costs are oftentimes astronomical. Now, association health plans address that by saying, okay, if your employer doesn't provide coverage for you, you ought to be able to pool with other individuals who are in an association or linked together solely for the purpose of purchasing health coverage. And then you gain the kind of numbers that are able to drive down costs for health coverage. It's an incredibly powerful idea. Association health plans have been we've tried to get those passed in Washington for years. Individual health plans is another opportunity for that. When you and Alfredo and I worked on this a number of years ago, we call it personal health management accounts, which gets away from the stigma that some folks have for AHPs or association health plans. But the core of it is to allow individuals who are not necessarily associated economically in any other way, other than wanting to pool their own resources to purchase health coverage together.
Now, Mr. Secretary, we're in D.C., right, where everything seems to make sense, of course. And but Obamacare was regulated out, or Obamacare, regulated out AHPs out of existence, basically.
That's right.
Why is that? Because it obviously seems to make sense. It's a great idea. It would probably have a huge opportunity for small business owners to actually help their employees out the way they want to. Why did Obamacare do that?
Yeah, another great question, but it gets to the point of what kind of problem are people in Washington trying to solve? And the challenge that we have from the left is that they believe that the problem in healthcare isn't that folks don't have an opportunity to purchase coverage, is that government doesn't control enough of health coverage or health care. And so if the left believes that is the problem, then the last thing that you want are opportunities or plans or programs or policies that allow for individuals or small groups of people in small business to be able to pool resources together to purchase coverage, because you believe, and on the left that is, that it's the government that ought to be controlling the purchase of health coverage, and the government that ought to be supplying this health coverage so that they can control the kind of health care that is delivered. So that's the problem. And it really is as simple as that. Now, many folks won't admit that, but that truly is the core of the problem on the left.
Yeah, it seems very frustrating because there's a plan, obviously, that was created. I believe Secretary Acosta also was working on association health plans. I think there was even some uptake on it and some interest. But again, I mean, now it's been stopped. What have you heard? I mean, what is the program? I mean, can we restart this process in any way, shape, or form? Or is it pretty much gone as an idea?
No, I do think it's possible. In fact, I talked with a member of Congress last night who was working with the study committee in the House, trying to fashion what their proposal ought to be. And association health plans is front and center on that, because it actually solves a big problem that we have, especially for small business and individuals. Now, the challenge is that you've got to be able to market it, if you will, in a way that lets people know that it increases choices, it increases responsiveness of the system, it increases innovation within the system to provide coverage for individuals that don't have it. It would increase access and decrease costs. But oftentimes, rarely do you hear folks talk about association health plans in those terms, which is why I'm so pleased to be with you all today, because the work that we did together a number of years ago, 5-6 years ago, on Healthcare for You, a program that was trying to respond to the needs and the wishes of the American people as it related to healthcare, specified specifically these personal health management accounts that would do just that, would solve so many of these challenges that small businesses and individuals have.
Dr. Price, the average small business family plan is now $26,000 per year, double the pre-ACA costs.
Yeah.
How did we get here? I mean, the big problem with the ACA, the big failure has been not what it tried to do, but what it's failed to do, and that's control costs. All they have done is skyrocket to the point where the government has to pay these subsidies for anyone to even be able to afford it.
That's right. Another great question, and I'll sound like a broken record, but when you put government in charge of things, the costs do not come down. They go up because government makes it more difficult to innovate, more difficult to run an effective and efficient program or an effective and efficient system. So their goal, again, on the left, is to have government be in charge of what health coverage is available for individuals. Now, what Obamacare did is that it actually increased the coverage. There are fewer individuals who are uninsured at this point, but that doesn't mean that individuals have greater access to health care, because even though you've got an insurance card through the ACA or whatever, you likely may not have specific health care because the deductibles or the copays or all the kinds of hurdles that government puts in place make it much more difficult to access that care. And at the same time, this individual and small group market has exploded in cost because the cost shifting that has occurred is no longer from individual to individual. It's from government-run programs to private health coverage that is run in the individual and small group market, and the costs just skyrocket. And so that's what needs to be addressed. The wonderful news is that we can address it, and association health plans or personal health management accounts are exactly what would incredibly help in decreasing the cost and increasing the access of health coverage.
Now, Mr. Secretary, I know that the President Trump is taking great strides and making progress on trying to reduce pretty much the inflation of drug costs, which is really also another factor
Sure.
outside of just the healthcare plans, alone. Drug costs are just going through the roof, and it seems like part of the problem has been this pharmacy benefit managers, aka PBMs, and kind of the
Mhm.
growth of that. Can you help us understand how PBMs have contributed to that possibly, and what we can do about it? Because again, those rising drug costs. I mean, I know I unfortunately have to have, pharmacy benefits myself,
Sure.
and I just see those drug costs continue to rise every day.
Yeah, no, it absolutely. And PBMs, or pharmacy benefit managers, started with basically a common sense, reasonable idea that if you could group or aggregate the purchasing of drugs for a large entity, a hospital system or a health system, and then you could get the benefit of aggregating those. So buying lots of product, you could get the benefit of driving down the cost and the price. The problem is that the PBMs have basically become the middleman in the whole system of purchasing a medication for virtually everybody, especially the large pharmaceutical companies. And that then they then drive up the cost, because they bump up a cost to be able to not just cover their costs, but to be able to profit. And they basically have a monopoly on the ability to be able to purchase medication from the pharmaceutical companies. So what's the solution? The solution, in addition to making certain that PBMs are not able to charge these exorbitant fees that they charge, it's to make certain that any savings that they realize go directly to the individual, directly to the person holding that policy. In addition, the United States still, you and I and everybody here in the States, essentially cover the research and development for pharmaceuticals for the world. And we do that through the incredible innovation and activity of our pharmaceutical companies. But one of the reasons that happens is because the pharmaceutical companies are basically extorted by other countries, developed countries, Western countries that say if you want to sell your pill in our country, you can't charge more than X. And so they say,
Wow.
okay, we'll do that, which shifts even more of the research and development costs to folks in the United States. Now, my challenge to the administration would be, this is truly a trade problem. If you want to solve this problem, then you don't allow those countries to do what they're doing from a pharmaceutical standpoint, as opposed to decreasing the innovation incentives for the entire system by not allowing pharmaceutical companies to be able to sell their drugs in other countries for the cost that covers their services.
Was this the conversation that was taking place and may have actually in part gotten into the one big beautiful bill? I think the topic or the phrase is most favored nation pricing or something like that. Is this the conversation that was taking place?
That's the conversation, but from my perspective, they focused on the wrong problem. That is, they what they did is decrease came down to the lowest common denominator. So they said that if other countries are paying X for a certain pharmaceutical and it's lower than what we are able to pay in the States, then we ought to be able to pay what other countries are paying. The challenge with that is that it doesn't then incentivize pharmaceutical companies to be able to then innovate and have the greatest health care ability in the world here in the United States. The real solution, as I mentioned, is to make certain that the other countries are paying their fair share, not that we decrease the costs for Americans. If we decrease the cost for Americans, we can do that by making certain that other countries are paying for their fair share, so that our costs come down, as opposed to bringing everybody down to this lowest common denominator.
Again, another reasonable, idea, which of course that's why probably it's not making it into any hands of Congress out here, right? Because it's actually a reasonable idea.
Yeah, exactly. Challenging.
Dr. Price, I came across a tracker of how many R&D projects and medicines have been pulled since the passage of the Inflation Reduction Act. And according to Incubate, more than 50 research programs and more than 25 medicines have been discontinued. That means fewer choices for patients.
That's right.
Do you think that these types of cancellations are going to continue?
Well, they will if you don't, again, address the root causes, the root problems that cause all of the challenges that we have from a pharmaceutical standpoint. We want innovation. We want research. We want folks to be out there trying to figure out the next great cure for diseases, so that we can decrease pain and suffering and mitigate the problem of disease in this country and around the world. But if we don't allow for financial incentives for individuals to do just that, it won't happen. There's a reason that the Nobel Prizes for science and for biology and for medicine, that the vast majority of them over the last 50 years have been awarded to Americans, folks right here in the United States. And the reason for that is because we have allowed for a system that has incentivized, from a financial standpoint, the ability for folks to gain a benefit, a financial benefit from their work. If you take that away, which is sadly, I think, is what is occurring. If you take that away, then you won't get that benefit. These bright folks will go do something else. They'll work in another industry. They'll work in another market. They may not even work in healthcare at all. And that's a major challenge that we have. And again, we've got to figure out why things are the way they are and have the solutions address the cause.
Do you think there's an opportunity for Congress to kind of walk back some of these price controls that have kind of crept up into passage of some of these bills?
I do, absolutely. But it requires them to stand up and legislate. It requires them to do policy that actually solves the challenges that we have. From my perspective now, I don't see a whole lot of policy work being done in Washington, and it saddens me. Because I spent a number of years up there working with some really bright individuals and folks who had passion about solving the remarkable challenges that we have from a health standpoint, and others. But right now it seems like all of that has kind of been pushed aside, and it's become basically a shirts and skins game up there, and if you're on one team, then you can't work with anybody on the other team, or vice versa. And that's not the way that we solve big challenges. We've got huge challenges in this country, not just in healthcare. You talk about the debt, or the kind of really difficulties that we have in individuals being able to realize their own American dream. But that requires policies that have the government getting out of the way, not getting in the way,
Right.
or doing more.
Right. That seems to be the fundamental difference, I guess, between what we've always talked about here, which is really kind of market-led solutions versus government-led solutions. I
That's right.
mean, um, and it does unfortunately seem, since we've had these conversations and we worked on it together, it's just gotten worse, not better.
I think you're absolutely right, and I don't know how you do that without individuals who actually appreciate and understand why and how the United States became the leaders of the free world, the leaders of the world. And we did so because we had an ability to fashion a financial system that incentivized innovation, incentivized creativity, incentivized folks going out and creating a better mousetrap, creating a better business. That competition, that competitive spirit, that competitive battle that occurs out there, that battle of ideas, this competition of ideas is what drives incredible innovation. But sadly, from my perspective, we don't seem to be incentivizing that kind of innovation, or that kind of battle, that competition that will result. You got to the challenge that you have in Washington is that people want to know what the outcome is going to be before you let loose, and that's not the way this works.
Yeah,
I used to have folks say, if we want to know exactly where those research dollars are going in healthcare that are going through the National Institute of Health. We want to know what benefit that's going to provide. Well, the honest answer is, from a scientific standpoint, is that you don't know. You've got to try. You've got to do things that will try to figure out what that new solution is, that new pill, that new medication, that new device, that new surgical procedure. All those things you may not know at the beginning. You've just got to try and fail and try again. That's so much. That you talk about somebody that tried and failed and tried again and then finally succeeded, was the founder of Job Creators Network, Bernie Marcus. I mean, what a wonderful example he is to the kind of process that you need to be able to find the best solutions. And we all miss him terribly, and I miss him personally. But his fundamental beliefs are what need to come to the fore.
yeah. I mean, it seems like, Elaine, that we have just, it comes back to like again, almost like a messaging issue, right?
Yeah,
For our side of the solution, right? The consumer driven solutions, patient driven solutions seems to, we have a messaging issue, I think, here. I sit here and I wonder why consumers aren't revolting. Why are patients revolting? I think it's so complicated now. They just don't even know where to start and how to revolt against it, other than say it's not working.
you're right. You're,
Um,
yeah, no,
Seems
absolutely.
like to me, at least, right?
And these subsidies that were put in place, they were put in place, increased, enhanced subsidies put in place for the purchase of through the exchanges, the ACA, were put in place during COVID. And if you go back, and maybe that was the right thing to do when folks were having a challenge getting covered and getting access to care during a really, really, really difficult time from a health standpoint. But you go back and you can pull the tapes of the Democrats saying this is only temporary. Don't worry about it. We just need to make certain that the government allows individuals, provides for individuals to gain access to coverage right now. This won't last. Once the pandemic is gone, these will go away. And now they're the biggest champions of continuing this government just tossing money at the problem. They don't really care that the problem's solved. They just
Right.
want to make certain the government has greater authority and greater control over what happens with individuals and their health care.
Mm.
Well, Dr. Price, last question before we let you go. Um, this vote taking place this week, we know is likely to fail. We also know that these subsidies are going to expire for millions of Americans at the end of this year, with no solutions on the table. What are your thoughts on just a few days left of the year, as far as the Congress being in session and coming up with a solution, not only for the people who are getting these subsidies, but for all Americans, so that we can all afford our health insurance?
Yeah, what needs to happen is what now I believe rarely happens in DC, and that is working to solve a problem incessantly. You just got to keep at it. You got to keep at it, and taking another week off or taking time off when these challenges are out there just doesn't make any sense at all. There are solutions. There are wonderful solutions that are out there. The Healthcare for You program that we put together is basically ready to go. If folks would just dust it off and recognize that the legislative language that exists that they could put in place right now to solve these challenges. Pick up that mantle and work to solve these challenges, as opposed to looking forward to the next election and figuring out how you're going to beat the other guy over the head with an issue. So I just implore our representatives and our senators now to recognize that these are real challenges and real people are going to get harmed. To take these subsidies away, in their language, to remove these subsidies and not provide for another alternative that's better, that exists readily, just doesn't make any sense to me. And so how the left will frame it, how the Democrats will frame it, is that the Republicans are taking away your health coverage. Well, that's nonsense. What they did is artificially inflate the government's control over healthcare. And so when you remove that artificial inflation of control over healthcare, you've got to be able to allow individuals to utilize their own resources from a tax advantage standpoint, just like other large employers do, to be able to purchase coverage. Association health plans, individual health plans, personal health management accounts, all those things do exactly the right thing to be able to solve this problem.
Well, Dr. Price, we miss your voice in Congress. They could certainly use your perspective right now. So I hope I hope your phone is ringing off the hook from current members asking
I
for
hear
your
there's
advice.
I hear there's an open Senate seat in Georgia next year. So maybe you should dust off your political side and come back.
Well, I've talked myself into a coffin, Jag, and I apologize. But the challenges are out there and solutions exist. People just need to embrace them.
Absolutely. Well, Dr. Price, thank you so much for joining us today on Main Street Matters, America's small business megaphone. And thank you all for taking the time to tune in. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show wherever you get your podcast from, and we'll be back soon with another episode. Bye for now.